In the Newsroom is a production in partnership with Studio Stillwater. Every week, journalists from the Stillwater News Press invite listeners to join us in the newsroom and hear the story behind the stories. Hello and welcome to In the Newsroom. I'm Bo Simmons, editor of the Stillwater News Press. With me today, city editor Michelle Charles.
Hello.
Reporter Ashlynd Huffman.
Hello.
And Chris Peters, not only producer, co-host of Studio Stillwater, but also in addition to the newsroom, in the newsroom, kind of meta.
Yeah.
But here you are.
I'm really in the newsroom now.
Yeah, that's right. We hired Chris pretty much last week. Yeah, started Monday. We don't have a job description for you yet, but you are in sort of like production / page design, copy editing / digital help, which we haven't gotten to a whole lot of that yet. I don't know. I mean, it's training. Like you've probably realized this. The software is not complicated.
No,
but there's just a lot of sort of like
there's a lot of steps. Yeah,
there's a lot of steps. It takes quite a bit of behind the scenes things just to get a paper out.
Mm-hmm.
You've been I can't remember. We started with sort of what we call dummying the paper.
Yep,
right?
That was new to me.
Yeah, which is basically setting up templates based on our ad cells and dimensions. Give the designer something to work with. But it's like now, because we all wear so many hats, you sort of see what would normally be like 3 different jobs.
Yeah.
Having you do all of it.
When I started, there were 3 different people doing all of those things.
Yeah.
Mm-hmm.
Yeah. But so now you've kind of seen it from like soup to nuts, right? I mean, the very beginning to the very end.
Seeing how, I'd always wondered coming in, I was like, okay, sometimes you're at this computer and then sometimes you're at a different computer. Why can't you do everything on one computer? Oh, that's because this was multiple people's jobs and there was somebody there that was at that desk, doing that thing, going through, working on the classifieds, getting the ads in. And that was one thing I learned was, the ads start first, place the ads on the paper, and then the content has to kind of fit around the ads.
Well, and that's the whole thing, right? I mean, the paper itself, the size of the paper, how much space we have, everything is determined by, it's supported by ads, and it's kind of determined by the ads. It's all driven by ad sales.
Yeah, how all that system works, and and then there's an ad missing, and then we go hit a button to search for it again, and it turns out we melted the servers.
Or
Michelle.
Something like, thank you. Yes, I'm also learning how to do dummying, and definitely. Yeah, I figured out if you don't select the right folder, it searches the entire news server for hours, apparently.
Mm-hmm.
So that's not a good thing. I had to come back the next day and finish it, but it worked out okay. That's a lesson learned, right?
Yeah, but I think we shut it down, so we didn't get to see if there was ever going to be an end to the ball spinning.
I wasn't so sure there would be. Yeah. I was ready to walk away and leave it overnight just to see if it was done by the time we came back the next day. But it ultimately just shut it down and started again. Luckily, we were halfway through the process, so didn't have to start from scratch. But yeah, there are a lot of steps to it. And I mean, and also the thing with moving to the different stations is that we only have so many software licenses, and we don't have every piece of software on every computer. So they only spent the money to put them on this, on the desktops or the computers where the person who really needed it worked.
Which makes sense.
So that's why you have to move around the building.
Yeah,
to do things.
I mean, looking at some of the software, it's like CS6. I mean, this is
outdated.
This is not necessarily the newest version of things, but back then, that's how that software was sold. Was you put it on how many computers you can put it on. Nowadays, everything's a subscription, so it's a little bit different.
Right.
But it's been quite a journey, kind of seeing how the sausage is made, so to speak.
Well, in one of these days, I don't know. Is he going to have a chance to use Quark?
Yeah, that's part of our classified system. We still use
I watched Jason, sports editor. I watched him use it.
Yeah.
Yeah, so that's kind of a blast from the past for a lot of people.
It was, but when we got here, they were designing with Quark.
Yeah, the whole paper was laid out with Quark.
I mean, I was trying to think. For the longest time, that's what I used. Then I got to Norman, and then they did an entire shift to InDesign and new servers and all kinds of different things. And then when I got here, it was reverted back to Quark, and then we went through that whole shift because we followed them by just however, a year or something like that.
Right. I remember we had a graphic designer who came in, and she was like a year out of college, and she just had this look on her face when she found out that she was going to be using Quark. And she said, I think I've heard of it. And that was kind of where she was. But, in some journalism forums, I see folks who've been in the business for a while going, that is a great program. They will go to the wall and defend it.
Who's to say we don't go back to something else, or,
right?
We don't know what's going to happen in 2 or 3 years. It
right.
could be,
who knows?
Could be something completely different that we've never heard of.
Well, one of the things a situation that we had, and this is the case with a lot of organizations, but especially, places like the news press, in an industry where, we have to really watch the bottom line, money's tight. At one point we couldn't upgrade our software because our computers were so old that they wouldn't support the new software. So that's one reason that we were still laboring along with the old stuff that was already on there, because that was all the hardware we had would support.
Yeah, I believe and you have the opposite where you've got older software that won't run on newer computers. And so that's why that Mac Mini that's running Quark, I mean, that's got to be like 15 years old. If
it ever dies, I guess we switch it over to something else, right?
We can rebuild it.
The $6 million computer.
Mm-hmm. But no, it's fun. It's fun to be now actually like in the newsroom, staying up till 11 o'clock, midnight, making sure stuff goes out, make sure we label the pages right for color or black and white, so the printer, knows how to print it right. Like all those little details go in. And then Bo has been letting me lay out some of the pages. I think the first prints page was this past Wednesday. I think I did the state page.
Yeah, I think so.
So if there's something that you're like, oh God, this is awful, it's probably me.
It is. It is him. I'm just kidding.
Oh, really?
I mean, Bo.
So
Bo fixes my stuff a lot.
Yeah.
Bo fixes everyone's stuff.
Well, I was going to ask you, Chris, when we first started working together on Studio Stillwater, you would give me a hard time because you would send me a text message or something, and I would reply at like 12:30, 1 a.m. Now you understand why.
Oh, yeah. I was like, Michelle is still up. Why is she still up? Now I get it. Like, so this morning, so I've still, I'm going to be up late, but I still got to take kids to school in the morning.
Right.
And then today was the first time I was able to like kind of go back and get back in bed and fall asleep for like maybe an hour.
Well, and a lot of times we're responsible for our own hours. It's like, there are things that could get us out of here a little quicker.
Oh, yeah. Like Michelle having to get up early to go take pictures at the hospital.
Right. Mm-hmm.
Yeah. Or I'm just saying, like, there's not a whole lot we can do about, say a football night like tonight. Today's for us. Today's Friday, and it's the first football game of the season. But there are other days when we don't have spot coverage late. So there might not be anything to keep us from getting out of here at 8:30 or 9. So it just depends.
Or sometimes we're just waiting on the lottery numbers.
Yeah, Ashlynd.
Yes.
You were wanting to make fun, but every time we talk to you about design,
I can't design. I will not.
Bug out.
It gives me so much anxiety just to think about it.
It's not that bad. It's just a lot. It is a lot of steps. It is so many steps, I've got to say.
Yeah, and little buttons like click on this
though.
Little thing that doesn't look like a button.
Yeah, and people who do it, they're just like, you just do this and this and this and this, and then you go over here and you do that, and they're like, oh yeah, just that. That's all. Mm-hmm. So I'm clinging to my directions.
It took me 3 hours to edit someone's face in Photoshop, so there's no way I can build the paper. Just
what
so
were
y'all
you doing
know.
To their face?
I was blurring it out, and it took forever because it was like use the rectangle tool, but then it gave them like a rectangle shape around their head, and I was like, that looks bad.
Yeah,
and I had to just keep going over and over.
Yeah.
I use the selection tool.
There you go. We're all learning all the time, right? I mean, and honestly, guys.
Inside dope.
But that is, but seriously, I know. I mean, a lot of this stuff is probably not interesting to anybody outside this room. But I will say this. The coolest thing about working in this industry and this job, and the thing I dearly, dearly love about it, is that we get paid to learn things.
Yes.
We get paid to learn new things every day. There's not a day I don't leave that I haven't heard something or learned something that I didn't know when the day started. And I think that is pretty freaking cool. I really do. I feel very fortunate for that.
Yeah.
Yeah, I mean, even the people you interviewed, they teach. I mean, I always do a little bit of research before, but they always teach me something new that I didn't know before, and so it is a learning job, for sure.
Right, and you learned pretty early on, right, to ask the question of,
yeah,
is there anything I forgot to ask or you'd like to add? Right?
Yeah. And, a lot of interviewing is about letting the person talk. So not really guiding them with your questions, but allowing your questions to make them or help them open up. That way they give you more information and it's not just so strict 8 questions,
Yep. I mean, a lot of times you need to see what the person has to say because your interview could take a completely different direction.
Oh, yeah.
Than you thought it was going to.
Never go into an interview with a story play-by-play of exactly what you want the story to be because you never know what you're going to get through that interview.
For real.
And you might get
Unless it's a
multiple
Q5.
stories. Yeah, Q5s are a little bit different. But yeah.
I think that's going to be one of my first tasks is try to get some of these Q5s out.
Oh, by the way, I saw the fire chief today, and he said he's going to be getting back to you.
Okay.
There you go.
Yeah. No pressure, buddy.
Yeah, right?
You guys were kind of busy.
They had a couple things going on, but he says he's not forgotten about you.
Speaking of that, I think Chris mentioned it earlier, Michelle, you were outside the hospital today for something that has, I don't know, ever happened in our lifetime, is they were setting up tents outside the hospital because there's a possibility, but we really don't know, that they would have to actually care for people inside of these tents because the hospital is so full.
Well, yes, that's exactly right. I have never seen, hospital tents set up outside in the parking lot at Stillwater Medical Center. Basically, what is happening is that the hospital is already very full. They are maxed out in capacity, especially in terms of their staffing. That's really the key point, is that, they don't have, first of all, a lot of beds available, and then they don't have a lot of staff to nurse or take care of the people in those beds. And the situation that we have with COVID, I mean, talking to the infection control coordinator, talking to the president and CEO, talking to the director of the ICU today, one of the issues is that when someone is in the hospital for COVID, they stay there for 20 to 30 days on average. It's not a quick turn. It's not like someone's in the hospital for 2 or 3 days and then they go home. So basically these beds are occupied for a long time, which means that, that same bed pre-pandemic might have seen 5 or 6 different people in that same period of time. And now that's not happening. Not only that, but when you have the ICU, they've expanded the capacity, basically more than doubled it. Normally 7, now it's at 15. And I believe the number of ICU patients they have, including ER holds, was at like 22, they said, 21 or 22. The other thing is, it's intensive care unit. The name says it all. Usually on the med-surg floor, you're going to have maybe 4 patients per nurse. In ICU, it's a 2-to-1, sometimes maybe a 1-to-1 ratio, depending on how sick the patient is. So now that staff that you do have doesn't go as far. So basically what we've got now is a situation where the city of Stillwater, the mayor, Will Joyce, has issued an emergency declaration, which doesn't really do anything except give them the grounds to call for assistance, to call for more personnel to come in. So the Medical Reserve Corps is sending doctors, nurses, and techs right now to help respond to, a a potential surge in patient numbers, because what have we got now? We've got the hospital full. We've got, incredibly high numbers of very sick people. And we've got a holiday weekend where people are going to be out at the lake. They're going to be riding four-wheelers. They're going to be drinking beer and doing all kinds of foolishness, I'm sure. And we've got a home football game. So we're going to have tens of thousands of people in town. It's going to be like 100 degrees. Everyone's going to be hanging around all day, tailgating, drinking alcohol instead of water.
So many things.
Many things are coming together.
Yeah.
It's like a perfect storm of just,
Michelle, how many beds or staff beds are they going to be adding with this tent?
They really were not absolutely sure yet. I mean, they were getting the tent set up, and then they're trying to figure it out.
A max, like they could fit 5, they could fit 2, they could fit 10?
I really honestly don't know, Chris, and it depends on how they're going to use it. That's the thing. I mean, that could become like the triage area. It could become like an actual treatment area. This could be the place where they take the people who just come in because they have, heat exhaustion, rather than the people who need oxygen and, and assistance in breathing. So, I mean, I don't think they're going to take COVID patients and move them out in the parking lot. I think this is probably, my personal opinion and guess, is that this is more likely to be the place where they're going to divert the people who are less ill, who would normally fill up your emergency room.
And this is kind of the drum that our hospitals and medical organizations, that this is what they've sort of been beating for a while, that sort of like, for COVID deniers, they wouldn't even accept that people were being hospitalized. But yeah, it's pushing other people out who would normally need those beds for whatever illness, injury, cardiac issues, those kind of things. And in that case, time is everything, right? The time you can get to care, it means everything.
Oh, absolutely. Absolutely. I mean, the whole thing is, if a COVID patient is in a hospital bed for a month, again, that's a bed that's not available for someone who has a heart condition or a stroke or something like that. And then conversely, if you have other people who are ill, every bed that's full of someone who's had a stroke or something, that's a bed that's not available for someone who is having trouble breathing because they have COVID. Again, talking to Nesha Kimber, the infection control coordinator at the hospital, who's had COVID herself, by the way, and was very, very ill with it.
Yeah. And
is still suffering some effects from it. So, I mean, she knows about these long haul symptoms. She knows how serious it is, how scary it is. And I mean, the people at SMC, I mean, they've worked so hard. And especially with Nesha, I mean, she's been like the go-to for every local institution. I mean, the school districts, anybody who needed help planning or some kind of professional perspective on it has called on her. Then she went down with it, got sick. And then as soon as she felt well enough to crawl out of bed, she had to jump right into the middle of it again. She didn't even get a normal recovery, so it's just been nonstop stress. But I asked her where was the furthest away they'd had to send someone. They have had to send patients out at times when they either didn't have an ICU bed or, there have been some, was it a diversion? Was it not a diversion? It was kind of a diversion is kind of what we've settled on.
Yeah, and I think for that, we just sort of had maybe different definitions between what, the ambulance paramedics call, being diverted to like a hospital just holding on to someone, keeping them stable until they can get them to somewhere else. So,
and that's exactly what it was. So from, finding that out, talking to Shyla Eggers, who's the director of, public relations there. Yeah, it was just a slight difference in terminology. Basically, I think for the ambulance service, they think that as long as they don't pull up to the ER and they tell them to go away, that's not a diversion then. As long as they take the patient, then that doesn't count as a diversion in the ambulance world. But for the hospital, they know they're taking that person in and they're just holding them with the intention of transferring them somewhere else. So to them, they're not really going to be admitted to the hospital. It's not, so they consider that a form of a diversion. because they're not taking these patients in with the idea that they're going to care for them long term. But anyway, so I did talk to Nesha about where they had to send people. She said they have called Albuquerque. She said that they have reached out to hospitals as far away as Maine and I think Montana. Basically what they're doing is right now, in these places like Oklahoma that have these surges, that have larger numbers of patients, they're trying to get patients to places that aren't as overrun. Those are the places that have a little bit of capacity. Now, what does that mean? How do you get them there? Do you put them on an airplane? Do you put them on an ambulance and have an ambulance drive 3 days to get them to another hospital in Maine? I don't know.
If only we had bullet trains.
Right? I mean, but seriously, these are the kinds of situations that our medical staff are dealing with every day at our hospitals. And then when you hear people say, oh, this isn't real, they're exaggerating. I mean, it's got to be such, not just a slap in the face, but like a punch in the gut, I have to think.
Right. And
wow.
The other lesson, I don't know. And you'll, maybe tell us a little bit of what, if you remember what Denise was saying during her sort of state of the hospital address she did today. But the other thing's got to be do the preventative care while you can.
Right.
Don't miss your checkups. Don't let something get bad.
Oh,
Don't go to Facebook and say, hey, what is this rash? Go to the doctor.
Yes, exactly. I mean, yeah, that's true. I mean, it's like, do your preventative care. Don't let yourself get really sick right now, folks.
No.
I mean, that is really the message. If you can take care of yourself,
to be sick.
Don't break a leg, don't go out and do something foolish. Don't, go run a table saw and cut your finger off. Don't do dumb things right now, I'm going to say. And take care of yourself. If you have a chronic medical condition, it's going to be really important to stay on top of that, because these are the same things that make you more vulnerable to COVID infection. So not only are you more likely to wind up in the hospital, but you're more susceptible to this infection, which could indeed kill you. And one of the things that they were saying is that they are seeing with the Delta variant, younger and younger people in the hospital. And by younger, I mean, they mean it, people under 50, which is younger than during the first phase of this, right? When we had the very first version of COVID-19 or COVID, circulating, that was the Alpha variant. And with the Alpha variant, it was mainly people who already had comorbidities or were older folks. And by that, we mean like over 65, over 50 for sure. Now you're seeing more and more people under the age of 50. You're seeing kids, you're seeing, young adults. And not only that, but when they talk about that transmissibility or how easily it is to give it to someone else, basically, they said with the original variant, with the Alpha variant, anyone who was infected, they figured that you might infect 1 or 2 other people. With the Delta variant, they're saying like up to 9 people.
Wow.
Like 6 to 9 people. So it's a lot easier to spread.
That's what kind of makes it scary with our kids. I mean, my kids have already missed school because of close contacts.
And so many people's have.
Like, okay, schools are not shutting down, but kids are still not in school.
Right.
Even though it's not their fault. In those situations, that close contact was another kid had more than likely tested positive and was in class. And like in our case, that happened on a Friday, but we didn't find out till Monday. So then since we got multiple kids in the house, they all quarantined because, we didn't know. And so that just extends everything. So now there's a week gone from school.
I think what we'll see, just sort of following how these things ebb and flow, we're gonna reach another kind of saturation point, right? Where either you're vaccinated and you're being careful, or you get it and you get over it. So we sort of hit that, and then we're going to start trending down again.
Right.
And then, we'll be back in school, everything in full swing, and then we'll still have the opportunity for boosters or not, or people to get vaccinated or not, or to still be careful.
Right.
And then when we see another surge in February or whatever, are we going to be back to the same place?
Probably.
That's basically
how
much of this do we It just keeps going.
Well, that's basically what Denise said.
Yeah.
They're really honestly thinking that for the next 3 to 5 years,
Yeah.
we're just going to see waves of this. And so it's, we're going to have a big wave and it's going to kind of peak and it's going to come up, then it's going to go down for a while and everybody will go, oh, it's over. And then here comes another wave. And it'll probably turn out to be more seasonal. I mean, it'll probably be, certain times of the year that we're going to see peaks. It'll be, eventually, of course, they're saying it'll become endemic, not a pandemic, which means it's just something we live with. It'll be like cold and flu season. Eventually it'll be COVID season or the season where you're more likely to catch COVID. And, but it's something that we need to be prepared for, and it's going to be around for a good long time. So people who don't take it seriously, I guess eventually they'll catch it and hopefully develop, natural immunity. Immunity in a natural way, in an organic way by having the disease. But it just sounds like it's not going anywhere anytime soon. And if people aren't going to be careful and they're not going to get vaccinated, I don't know how they're going to avoid catching it at some point.
We'll have to get in the gym with Ashlynd and take all those supplements and just keep ourselves in tip-top shape, right?
Oh my gosh, can you imagine a whole newsroom just eating protein powder and oatmeal?
We're going to need an outside gym. We're going to need like Gold's Gym at Venice Beach. We're going to have to do a gym outside. I'm not going to no gym inside. I don't know how you do that.
Yeah.
I don't know. I'm starting to think about wearing a mask to the gym again just because.
But you mentioned going into different courthouses and whatnot. You've seen more precautions though, right?
Yeah, at the Payne County Courthouse yesterday specifically, I saw they brought some inmates into the courthouse or into the actual courtroom. They've been doing it by video, but all the inmates had masks on and the jail staff had masks on, and then some of the lawyers had masks on. And, I eavesdrop, so I know the lawyers are vaccinated because they were talking about it. So, it's not that they're not vaccinated. They're vaccinated, but they're also taking precautions.
And there's no one really above them telling them to do that. Mm-hmm. Outside of it would be the sheriff's department, which handles our inmates. But, yeah, no one on the state level, certainly not coming from the county commission who have ordered something different in the courthouse.
The inmates are probably, a little self-aware to know that, it's going to spread in there. And then if they need a hospital and the hospital's not available.
Yeah.
That is true. And the thing is, someone being in the hospital for 20 or 30 days, that's not cheap.
No.
And that's on the county's dime if someone who is incarcerated at our county jail gets sick. So that would be another thing. This all snowballs. And, the more we look at issues, we understand, I think probably better than most people, how many things are interconnected, how it all eventually just kind of weaves together. So, one thing affects the next. But it's a tough situation right now. It is a serious situation. People need to know that. People are trying to make the best of it and do the best they can. But there are so many ways, big and small, that our systems are being stressed right now. And that's something that we really need to be aware of, because they can get to a breaking point where they're not functioning for someone who really, really needs it. Mm-hmm. And that's what we're all worried about. That's what they're terrified of. People talk about doctors and nurses, respiratory therapists. This is a huge thing. Talking to the director of the ICU, Mary Beth Hunziker, and she said that SMC was adequately staffed with respiratory therapists before the pandemic. But now that we've got patients in here who are severely ill, who are staying for long periods of time, greater numbers of them, and basically every aspect of their care, because of the nature of the disease, requires respiratory therapy. It means that they are
so we need like a
thin.
Fast track
for respiratory
education
therapists.
For respiratory therapists and nurses and all that stuff.
Yeah, they've
they're hiring. I can tell you that.
Oh yeah,
they're hiring,
they're hiring.
But don't you need them educated first?
Yeah.
Oh, no, there are people coming out. I mean, I'm sure there are people who've coming out of
Yeah.
retirement who've taken breaks or whatever who are like,
And that's some of the volunteers that are going to be in this tent, right? Or possibly
Well, they're saying
retirees?
doctors, nurses, and techs. So we don't know exactly what kind. I was inside the tent taking photos, and they were like, if you're going to stand inside the tent, Michelle, you got to work. And I'm like, okay, I can clean up and I can fill out forms. That's what I can do for you.
Well, there's some of that too.
Yeah.
Yeah.
And there is some of that.
And there's always volunteer opportunities.
Absolutely. And actually, people who are interested in helping with the Oklahoma Medical Reserve Corps, you can do that. You can volunteer to be like an intake clerk. You can volunteer. I mean, if you're a nurse, probably even someone involved in the veterinary field.
Yeah, I think
could
we saw
volunteer.
all that information is right on their website.
Yeah, absolutely. So, I mean, this is another opportunity to help. And basically what they do is you get mobilized if there's a natural disaster, there's a situation like this where they think that the local system could get overwhelmed or they just can't handle the capacity that they're going to see. So that's an opportunity for people to help out. Think about it.
One of the advantages I have is I get to read a lot of things before other people see it. But by the time this comes out, people will be able to take a look at this because it was really interesting. Something I hadn't thought of with all the misinformation and everything else that floats around is we had one of our veterinarians from OSU Vet Med, I think it's Dr. Schoonover, wrote this column about getting veterinary medical advice from social media. Well, of course, the idea is don't do this.
Yeah.
But it was, and we talked, we talked about ivermectin and things like that. But he was just saying, in general, because what I say earlier about how many people go on and say, hey, look at this thing on my arm. What do you guys think I should do about it? And, and he was talking about how people do this with pets as well. They'll solicit advice. And I think the point he was making here is that could actually be considered, if you were to give someone specific medical advice, it could be considered what is the practicing medicine without a license if you're doing this, even on social media. And it sort of blew my mind about how simple of an idea that was, but something I hadn't thought of before. But how many times have we seen that? How many times have you gone on and, even in like our comment thread,
Sure.
when we post something about COVID in general, you'll have someone commenting like, oh, you just take this and this and this, like it's going to cure COVID.
Like, how specific does the
Yeah.
advice need to be?
I know, I'm very
We
curious.
don't know.
and how much
We don't
how
know.
much is still sort of a freedom of speech issue as well.
Yeah.
There's so many layers to that. But
Yeah, it's a good
Just-
question.
That's interesting.
read that column. It's going to be it's Veterinary Viewpoints. So go check that out right now. It's really interesting.
Well, and I would posit that, there's been an awful lot of practicing medicine without a license going on over the last 18 months. I mean, if you're going to, depends on how broadly you define it, but, And one thing, I did want to touch on ivermectin a little bit because I did a story on that this week. And one of the things that I'm trying really hard to be respectful to people because I think there's a large group of people who feel sort of disrespected by a lot of the coverage or, the idea that, oh, it's horsewormer and you must be dumb if you're taking it or something. And I think that, yes, ivermectin is used for horsewormer. It also is used for cows and pigs and sheep and to kill heartworms in dogs. But there is a human formulation that is basically considered a miracle drug in the Southern Hemisphere, in places where people tend to develop intestinal parasites, where this is a fact of life and a huge health problem. Actually, one of the developers of ivermectin did win a Nobel Prize for Medicine in 2015. That is actually true. So there are legitimate uses for ivermectin in humans.
With the
Having
prescription.
said, yes.
Yeah.
Under a doctor's supervision, using the right dosage, and also it's still an antiparasitic. It's not been approved or even shown to be effective yet as an antiviral. Basically, somebody apparently somewhere threw a bunch of ivermectin in a petri dish with some cells, and it seemed to, I don't know, keep the virus from, replicating or something. I mean, apparently there was some kind of very preliminary thing that showed some type of antiviral effect. The problem with this is that they used a concentration that was so much higher than what you could achieve in a human's bloodstream by taking a safe level orally.
But if you think about it, that's always sort of been that way. Like, if you are treating yourself,
right,
like, people often do, and you're going to have this very anecdotal experience with that, and you don't even know if that thing you took is what made you better, but you're going to swear by it.
Joe Rogan.
Or anyone, honestly, though.
Weren't we supposed to be drinking bleach or something like that?
I don't know.
I mean, it could be just hot toddies.
Yeah.
And
chicken soup.
Yeah, that's the thing. You're going to swear that that's the thing that made you better.
Right.
When really you may have just gotten over it.
Yeah, I mean, no, that's absolutely true. But I mean, my whole thing with the ivermectin was that, I tried really hard to not basically talk down to people, but just to say there are health professionals who say, yes, there are legitimate uses for this. However, please don't just go grab it off the shelf at the farm and ranch store and get some random dosage off the internet and take it yourself. If you really want to try this, talk to your doctor and see if your doctor agrees. The pharmacist I talked to basically said that, he doesn't know that it'll help, but if you're taking it under doctor's supervision and you're taking the recommended dosage, it may not hurt you much either.
Yeah.
And that's really the key. Because all of these things are designed to kill parasites. So there is a toxic level, there is a lethal level of them. And you really do have to be careful with that. But I don't know, I just thought it was interesting because it is a valid drug for certain uses and under medical supervision. People are misusing it. That's the problem.
And here's our disclaimer. This is not medical advice.
This is not
Michelle
medical
Charles
advice.
is not a doctor.
I am not a doctor, and I am not. I'm telling you to call your doctor. Don't do this. I'm not telling you how much to take.
Hopefully your doctor's not too busy to take a phone call like that.
Right? I mean, that is another issue, of course. And also, something really interesting was that the same pharmacist said that he is seeing a lot of prescriptions from doctors coming through his pharmacy, and it's not like there's a sudden outbreak of intestinal parasites in our city. There are more doctors that are prescribing this for their patients, and to the point where the supply is getting low and the cost is going up. He said a course of ivermectin at one point would have cost $40 to $50. It's up to $120 now.
Supply and demand.
Supply and demand.
And are we going to have to start regulating telemedicine now? Because that's, a lot of this stuff this is not coming from our local physicians, a lot of it.
Right.
You can get on the internet, get on the phone, find someone who's going to write you a script for whatever. So who knows?
Oh yeah, just like anything else. I mean, if you want Viagra, if you want, medical marijuana card, if you want whatever, you can find somebody
will
online.
give it to you,
Yeah, you can find somebody online who will write you a script, which is not a great thing because they don't know you. They don't know what's going on with you. Again, not medical advice. And I'm saying if you talk to some rando on the internet, maybe that's not medical advice either. That's what I'm saying. I'm coming out strong.
Sass.
I don't know.
So sassy.
Right? Anyway.
That's right. Don't take your medical advice from us or from Facebook or YouTube.
Yes.
You want to go in that room where they've got those,
That's right.
their certifications on the wall there.
Look at a diploma. Yeah, do that. Or you may wind up in a tent in a parking lot. That's what I'm saying.
Mm-hmm.
All right. We'll see how it goes. Yeah, please do check out that column, Veterinary Viewpoints. It'll be up. Should be up by the time you hear this. Take a look. It's interesting stuff. I think that'll do it for us this week. Thank you for joining us in the newsroom. Thank you for joining us in the newsroom. Look for Studio Stillwater wherever you find your podcasts. Find archived episodes on stwnewspress.com.